Hi, my name is Michael L. Woods, and this is my story.
Hi, my name is Sandy Tedesco, and I'm here to share a story about what happened to our son.
Addiction is not a moral failing. It's not a choice that a person selects to do or to have a diagnosis. Addiction is a medical diagnosis. It's very similar to when we talk about diabetes and heart failure.
When I was 17 years old, I was in upstate New York. Wrong place, wrong time, and I got shot. It wasn't a life-threatening wound, but I had the bullets stayed in me, and I was out the hospital in 2 days with a script of hydrocodones.
We recently lost our son February of this year to an overdose. He struggled for many years, and it started with a medical problem that he had. He had a back injury years and years ago at 20 years old, and he was prescribed from his doctor hydrocortisone.
I didn't know what the effects were supposed to be. I just know that it said take for pain as needed. So I took them for pain. I kept taking them more and more and more and more because the tolerance built up. I was on it for about 2 years.
And he was given a prescription for about 7-8 years. And he took these as prescribed by his doctor as he had faith in him. That was his medical provider, so he trusted him. And he did it. And then after a while, it became the prescriptions didn't last long for him. He was going through them before the month was up. And then it led him down the road to use other drugs to ease the physical pain that he was experiencing every day of his life.
Stigma, that word is old. It sticks with you for a long, long time. I'm 47 years old. And I've had that stigma tag placed on me as long as I can remember. If it wasn't one stigma, it was another. Jailbird, drug addict, lowlife, scumbag, even the N-word.
Nobody wants to be an addict. Nobody wants to be a heroin addict or rely on opiates or anything like that to survive every day. So that stigma, I do firmly believe, hinders them. And I think as a community, our lack of understanding hinders them. And then that creates even a bigger stigma attached to being addicted to something, to struggle with that addiction.
You know, we know that addiction is an illness. It can happen to anyone, any social class. There's no particular demographic. It's across the board. Trying to explain to people that it is an illness, and that if they're family members, friends, coworkers, whatever the case might be, that there is help out there for them. And we're trying to do that by literally going into the neighborhoods with Narcan, with safe kits, with whatever we can to alert them and reduce the overdoses that are occurring, and tracking them so that we can work with law enforcement to enact and go after the drug dealers and what's taking place, but more importantly, focusing on saving lives.
Yesterday I received a message from a community member who doesn't know me personally, but they are familiar with me being the sheriff. They saw the spike alert that recently went out regarding us having 4 overdoses within the past 24 hours, one of which was a fatal. They saw that spike alert, and that was the one thing that kind of pushed them over the edge to make that call. I, in turn, reached out to an amazing group of people who we work with on this task force. And again, we're talking now, it's late night. It's not a work day anymore. We're all home for the night. I reached out, made some phone calls, got him a phone call of someone that he can reach out to. And last night, during the night, the search is underway not only for their son, but we're also getting the family into a program where they can learn how to deal with this problem.
The stigma that comes with the addiction opioids is problematic. A lot of times it's problematic for the person that's addicted because they don't want to admit they have the addiction problem. And that hurts us a lot of times on how we would direct the person within the criminal justice system. So for example, when we're dealing with someone with an addiction problem, a lot of times we like to get them into our drug court. And the drug court's set up to try to help them recover from the addiction and help them get back on their feet and become a productive member of society. But a lot of times just the stigma and admitting that they have a problem is one of the hardest things to overcome. The Good Samaritan Law was passed in 2011. And the reason it was passed was because at that time what they were able to figure out was that about 85% of the overdoses that were taking place, there was somebody present that could have made the phone call, but weren't because they were afraid of being arrested and being charged with the drugs that were there. So they passed that law to protect the person that made the phone call and also to protect the person that was overdosing. And that law, in my opinion, since that's happened, we've seen, and we see it every day, where people now make the call. And it's saving a lot of lives, and you know, between that and the availability of Narcan in the public arena, those two things are really making a big difference on saving people's lives. We still lose a lot of people every year, though.
There's lots of solutions to this, right? Engaging with people who have lived experience is not something that we do at a health system level nearly enough. You could read every article and every book around substance use disorder, but until you talk to a person who's been through it and you understand their perspective as an individual with lived experience, it's just so hard to put those pieces together. So we can engage, we can build our networks and our understanding. And the more we do that, the more that we as a society say we care about people with substance use disorder, just like we care about people with diabetes and we care about people with heart failure. The anti-stigma work will sort of come. The positive health outcomes will come.
This is not just talk, it's real action, and it has been. And I'm very proud of that because so oftentimes when we try to deal with a particular situation, it seems that, you know, statements made, committees put together, and you never hear from them again. That's not the case here. This is ongoing work every day in which we're tracking, we're working with our partners, we're on the streets, we're trying to really resolve a problem that is going to be around, and we know that it's not going to be easy, and we know that it's not going to go away overnight or in time, but we are saving lives, and that's what motivates everybody. It motivates me in terms of this because of the lives that we've saved, and that's why we're going to keep going.
I stuck around, and to this day, I'm still a New York State certified peer for ACR Health. And I'm on NETs, and I'm still pushing the good fight, still keeping a positive frame of mind, and still pushing harm reduction to the peers, my peers. Because not only that I go through an opioid war with myself and the woman I love, but I go through it every day with these people, with these soldiers, because it's like a war. Soon as you step out your house, anything you want negative is there. But I also realize anything you want positive is there too.
We have good days, we have bad days. I'm doing this to help make other people aware, hopefully make the community aware and change their outlook of how they view people that struggle with addiction and the stigma that's attached to it, to help the others that may be struggling. For us, it's been a nightmare. My grandson lost his father, like I said. We lost our son. My kids lost their sibling. Our life has been so altered. And it's day by day. I say, I feel your pain. It's okay. I feel your pain. If you need somebody to talk to, you need to seek help. It's okay. It's all right to feel the way you are. We all grieve differently. We all grieve. The length of grieving, the stages, we're all different. I tell you, I'm sorry that you lost your loved one. And I pray for you every day.